Well, good evening, everybody. I'm Tom Salt. I'm a medical doctor and functional medicine practitioner, and this is Just Be Well.
I'm Elizabeth, a registered nurse and life coach.
Exactly, and we're finishing up a week of talking about Lyme disease. We started out with just a basic idea about what Lyme disease is. We talked about something called LDI and how LDI can help people with chronic Lyme disease. And now we're going to just talk about the journey, a typical journey of somebody with Lyme disease. So, Elizabeth, you mentioned the other day that you had Lyme disease, and how did you first sort of become aware that there was something not right?
I would say the first symptom for me was just this fatigue, or almost like a heaviness. And you know, I just couldn't understand why I didn't have the energy to do the things I wanted to do. And it was even more than not having the energy. It was just like there was a weight on my body, and I just couldn't move. I couldn't do those things that I normally love to do. Like when I went to the park with my kids, I would have to sit on the bench and watch them because I wasn't able to run after them and play. I just didn't have that push to do it. And for a long time I actually really blamed myself for this. And you know, was like my worst enemy, because I would tell myself, Elizabeth, you're just being lazy, just get up and do it. But there's something about that that type of fatigue or heaviness that you really can't just get up and do it. I couldn't. And it was really an internal battle for me, because I would try to push myself. I would push myself to that limit every day, which made it worse as well. And then quickly into that went, you know, difficulty sleeping. I was fatigued all day and felt like, you know, every time I sat down, I would close my eyes and fall asleep. But then also I couldn't sleep at night. And even if I did sleep, I woke up feeling like I just couldn't get out of bed. And then I started to have issues with brain fog, which goes along also with the sleep disturbances, because I think all of us have problems with brain fog when we're not sleeping well. And then I had GI discomfort, palpitations, and muscle and joint pain.
So what were your first medical encounters like when you were first experiencing these symptoms?
You know, I didn't really go to the doctor for the fatigue. I didn't have that checked out. I think at one point when I went in for my GI symptoms, he did do a little bit of a workup just to see what my hemoglobin was, just to make sure that I wasn't low in anything. But the main focus of my visits were my GI symptoms. And then I was put on things that just actually made my symptoms worse.
That's not so great.
Just because, you know, they were putting me on things that helped with like indigestion, or people with frequent heartburn, those PPIs. And really it almost caused a worsening of symptoms, and then I had nausea, and then went into more problems with elimination. But I had testing done, like I had, you know, all the blood work done, plus I had an upper endoscopy done, an EGD, and all that stuff came out clear for my heart issues. They were quite significant, and with them also came fatigue. When I was having those heart symptoms all day, it made my fatigue so much worse. So they did, like, you know, echocardiogram, EKGs, stress tests, everything was great. That's what I heard over and over again, is you're fine. Like, everything looks great.
You're in great shape for the shape you're in.
Yeah.
The fact that you feel crappy has nothing to do with it. All your labs look normal. Yeah, and you know, the average person with chronic Lyme disease suffers like this, going from doctor to doctor to doctor for years. Hi, Yolanda.
Hi, Yolanda.
And that's really the travesty of it. The other travesty is, yes, happy Friday. The other travesty is studies show that when doctors are presented with an erythema migrans rash, which is the rash of Lyme disease, most of the time it's misdiagnosed as a different kind of dermatitis. Also, many times when people are confronted with an erythema migrans rash, they will tell the patient, well, we'll do a Lyme test. And so they do a Lyme test, and the Lyme test comes back negative. Well, for most people, when they have the acute Lyme erythema migrans rash, it's too early for the test to be positive. So they have the rash, which actually the Center for Disease Control says is all you need for the diagnosis of Lyme disease. If you have an erythema migrans rash, that is diagnostic and you should be treated. But you come in, you say, gosh, I have this weird rash, I feel crappy, and they say, okay, well, let's get a Lyme test. Lyme test comes back negative, and you're told, oh, see, you don't have Lyme. Well, unfortunately, that's a mistake. And so then your Lyme goes untreated and you get sicker and sicker. And because you've already been told it's not Lyme, you look for everything else under the sun. And for many people with chronic Lyme disease, everybody settles on the idea that you're just hysterical, or that you have depression or anxiety, or, you know.
Right. Which I ended up with those symptoms as well. And did it come from just all the other symptoms and not being able to do the things I wanted to do, or was it part of the process as well, the infectious process?
And hello to Sonia.
Hi.
Yeah, so it's really frustrating. And then there's so much controversy around this diagnosis. Everybody agrees that acute Lyme disease exists. There's difficulties with diagnosing acute Lyme disease, as I just described. But this idea of chronic Lyme disease is really controversial, to the point that just mentioning chronic Lyme disease will set some doctors right through the roof. And I've even had patients who've been treated, hi Jackie, I've had patients treated very, very poorly. And you know, the doctor yells at them and so on, and their response is, listen, doc, I don't care. I don't care what it is. I just want to feel better. And they say, well, it's not Lyme disease. And they storm out of the room. It's like, well, what is that about? Why does that happen? I don't understand that part of this whole thing. Regardless, people say stuff that's just wacky all the time. You know, people will say, well, I know it's the Lipitor that's making me sick. And you say, well, when did you start the Lipitor? And they say January. And you say, okay, well, when did you start getting sick? 2 years ago, February. You know, it's like, well, those time frames don't add up. And, you know, we don't get mad at people about that, but just saying chronic Lyme disease sets some doctors right through the rafters. It's kind of crazy. I really don't understand it at all. But it is this complex problem. And part of the problem is we don't know what's going on. You know, there's this whole emerging science around what are known as antibiotic indifferent forms. And it appears that certain kinds of antibiotics can go into the cyst state and be essentially completely resistant to antibiotics. And then when the antibiotics are withdrawn, they come out of hiding. So that's one mechanism. Another mechanism is that Lyme disease appears to really cause a flare of autoimmune processes. So people with Lyme disease will have positive ANAs, and they'll have all kinds of positive autoantibodies, which can really cause issues. Hi, Ken. And that can result in symptoms all of their own. So some people say that chronic Lyme disease isn't even about Lyme disease. It's not about the Lyme bug at all. It's about autoimmunity. But the truth is we don't know. And so the only rational thing really is to think about a whole life approach to this problem. And that's what functional medicine does, and we'll talk about that in a minute. But first, Yolanda said something. Can you make that bigger? Because your fingers seem to work better than mine for some reason.
Yes, I have had many doctors tell me I'm too complicated, or maybe just try to give me an antidepressant. It's amazing to be seen, have an option for treatment, and work towards being well.
Yeah. And
I agree, Yolanda.
Yeah. You know, I think as physicians, our job really is to listen deeply and be present. And this somehow we've developed this adversarial relationship in medicine, where many of my colleagues seem to think it's like some kind of sparring contest, and all I'm trying to do is get you out of here as soon as possible. And of course, part of that is because they're under such tremendous pressure to see more and more and more people. Medicine has become commoditized. It's gotten to the point now where the idea is you make a diagnosis and then there's a protocol. And the protocol is pretty much one size fits all. And that doesn't matter if it's acute heart disease or chronic heart disease. There's a different protocol for each. There's a protocol for high blood pressure. There's a protocol for high cholesterol. There's a protocol for diabetes. And it's one size fits all. But it turns out that there's vast uniqueness in individuals. And we're outside again, and my Presto Change-O glasses are getting darker and darker by the second. So that's the beauty of functional medicine, is that it really takes an individual approach. Wow, Misty, yeah, your Lyme disease developed into lupus, and finally pulmonary hypertension with systemic sclerosis. Yeah, that's terrible.
Infections.
Yeah.
Infections seem to be the root of the dysfunction. Functional medicine has improved my health the most.
Yeah. So we've talked ad nauseum about the 5 modifiable lifestyle factors, and that's just sort of the foundation. Get some of that stuff straightened around. But really, there's 7 domains of physiology that we always talk about. We talk about basically digestion and absorption, or the way you get nutrients into your body. Then we talk about the immune system, defense and repair, which has to do with defense and repair and inflammation and regulating those, stopping those when we're done with them. And that's part of autoimmunity, is things don't stop. Hi, Carol.
Hi, Carol. I thank God a lot for working, and getting care from you.
Oh, well, thank you. And then there's after the immune system, then we think about energy and how do you convert your food into energy, because without those high energy molecules that your body manufactures out of your food, you can't do any biochemical process. So you can't make antibodies, you can't make hormones, you can't repair your muscles, you can't repair your tissues, nothing. And then detoxification, getting rid of bad stuff, getting rid of toxins, really important. And then communication. So all the molecules of emotions, the molecules of communication, whether they're hormones, and not just sex hormones, but pituitary hormones and thyroid hormones and adrenal hormones and all those hormones. And then other neurotransmitters. So we're talking about serotonin and dopamine and norepinephrine and all the things that we've heard about regarding, again, those molecules of emotion, which, by the way, is a great book by Candace Pert. Kind of old at this point, but it's still a good book. And then after communication, sort of structural integrity. And most of the business of health happens on cell membranes. People think about a cell and there's a nucleus, and everybody talks about the nucleus being the brains. It's not true. The nucleus is just the gonads. It's just the ovaries or the testes of the cell. The cell membrane, the outside, that's where all the receptors are, and that's where all the decisions are made. So having healthy, fluid, dynamic cell membranes, and that really is talking about healthy oils in your diet. And then the center of the matrix, the mind, and the spirit. Mental, emotional, social, spiritual domains of health. And we know that those things are critical, and the longer you have chronic illness, the more isolated you become, and the more those kinds of things deteriorate. Our notion of purpose and place in this context of both living and death become distorted, and our sense of self-worth falls off. And so we have to address all of those things and optimize all of those things. And then we layer on top of that Lyme specific. Many of the things are Lyme specific. Almost everybody with Lyme has heavy metals. And it's really fascinating why that is. I mean, I don't know why it is. It just turns out to be true. Maybe it's because people who are susceptible to Lyme are the people who are, already toxic for one reason or another. Maybe maybe the subset of people who get chronic Lyme are also the subset of people who have genetic weaknesses in their detoxification or whatever. But many people with chronic Lyme have, elevated lead or mercury or cadmium or whatever. And so you fix that stuff. And then you layer on top of that Lyme-specific treatments like herbs that have been shown to be actually as good or better than antibiotics with fewer side effects. So we layer that on top. We use oregano oils and stevia and other things like that. And sometimes we use them in special preparations, liposomal preparations, because liposomal preparations, which is basically taking the herbal concoction and wrapping fat around the little droplets, it can get into your brain better. So there's all kinds of little techniques and tricks, but really we need to create this whole life approach, because the truth is we don't know what's going on with certainty. One person will tell you it's a chronic infection, and the next person, we can't find any chronic infection. It looks really to be an autoimmune process, and the next person, of course, thinks it's all psychosomatic, and so on and so forth. And we have to really, it doesn't matter if it's one or the other. You feel crappy, and we need to treat it. And this whole life approach seems to be extremely effective. Not quick. This isn't like strep throat. You don't get better in 10 days. I like to tell people, give me a number, 0 to 10. And 0 is can't function, and 10 is perfect, vibrant, effortless health. Where are you? And they say, I'm a 3. Most of my patients tell me they're a 3 when I first meet them. Well, I say, okay, well, here's what I expect. I expect you to get better by about 1 every 3 months, except for you probably won't get better at all in the first 3 months, and in fact you might get worse in the first 3 months. So if they're a 3 and they've got to get to 10, that's 7. Well, 7 times 3 months is 21 months plus the 3 months they didn't get better. So we're talking about 2 years. So it's not a quick process, but it is a process that's pretty predictable. And Stacy, hi. Am I accepting new patients? Yes, we just opened a virtual clinic, actually. If you go to our website, which is justbewell.info, you'll see a little red thing up on the upper menu, and you can click on that, and it takes you to the scheduling thing and whatever. There's also a bunch of information on the site about functional medicine, and so you can learn more about what it is and how we do it. So, yeah, that's Lyme disease, and I like to say it's a master's class in functional medicine because it's very complicated. It's not, oh, here's your, bunch of stuff, go home and take it. It's, the movie Red October. I love the scene where Sean, what's his name, Sean Connery? No, that's the old guy. Sean
Penn?
No, maybe this Connery. I don't think so. Anyway, he's looking through the periscope, and he turns around and says, verify their distance, 1 ping only, and everybody's shocked because, they know that if they use the sonar, they're going to give away their position. But I say ping. We're going to ping you. So you're going to come in, we're going to do our best, and we're going to start treatment. And then you're going to come back and you're going to say, well, this is better and that's better, but this and that and the other thing are worse. Well, before you leave the first time, I'm going to tell you that I'm not going to get it right the very first time, and that any information is important information. Whether you feel better, whether you feel worse, or whether you feel the same, that is important information, and it tells me something about your physiology that helps me make the next decision. So you come back and you say, this is better and that's worse and this is unchanged. Okay, so we're going to make some tweaks. And then you're going to come back in another 3 months or something, and are you better, worse, or the same? Well, okay, we're going to make these tweaks. And we keep making these tweaks until, because each time we make a decision, it actually changes everything else in that web we were talking about, that thing we call the functional medicine matrix. And then we have to make additional little corrections. And so as we make these corrections, we get just a little better, and your system becomes just a little more robust. And that is where her expertise comes into such dramatic help, because I'm giving you these supplements and that diet and this thing and that thing, and you're going, holy crap, how do I do all that stuff? Well, she's been there, done that, bought the T-shirt. She knows how, right? I know what to tell you, but she knows how to do it, right? There's a big difference. And so that's where her expertise comes into play. It's really a powerful thing. Mandy.
Hi, Mandy.
Is in the house. All the way from Michigan. We got California. We got Florida. We got Minnesota. Yeah, sure. So tell us a little bit about helping people with this, coaching. You know, what kinds of things do people need help with, and what do you do? And
you know, a lot of it is just picking out those
Texas.
No, in Texas. Is picking out those things that, you know, work for them. So, you know, there's a lot of different things you can do. There's different diets. There's different ways to, you know, help with sleep management or rest and relaxation, you know, meditative pieces. Some people aren't able to meditate, so we find another way to calm your autonomic nervous system, because really your autonomic nervous system is what's driving a lot of this too. You know, a lot of these symptoms are made worse just by the fact that we, with chronic illnesses, are kind of stuck in that fight or flight response. So, you know, not only are we completely, our body is always on high alert physiologically, but we're on high alert, and then, you know, the littlest triggers, whether they're environmental or dietary, they can really emotional, set us off. And, you know, we're not absorbing our food the way we should because of our GI symptoms, which, you know, some of those are also because of the fight or flight response. So really, you know, it comes, you know, not only to those outer 7 parts of the matrix, but that mental, emotional, and spiritual part. For me, I think for patients is one of the biggest things. You know, how are you processing your emotions? You know, what are your thoughts? What do you tell yourself all day long? Spiritual wise, you know, do you feel connected to something greater? Do you feel like, you know, you're serving your purpose in life? Do you have a sense of belonging? And all those things, a lot of times if we go back, you know, they're kind of the driving force of everything else. There's a reason why they're in the center of the matrix.
Exactly. And it's not that we're saying it's the cause, but it's a perpetuator.
Right, exactly.
Yeah. And so, you know, with anything that's a perpetuator, we call them, so we have antecedents, triggers, and mediators, and we call them mediators. Mediators are sort of anything that is continuing to make you sick. It might not be the thing that made you sick. That would be an antecedent, would be the thing that predisposes you to sickness. The trigger is the thing that actually set off the disease, and the mediators are keeping you sick. And this mental, emotional, spiritual domain often is keeping you sick because it just deteriorates as you are chronically unwell. It becomes so difficult to see yourself as a human being of worth when you're laying in bed all day feeling like
you can't get out of bed.
You can't get out of bed.
Yeah.
You can't take care of your kids. You can't cook dinner. You can't care for the house. You can't do all the things. And we Americans, we're really good at making our value about our output and hygiene. So, you know, this is just unfortunately part of the whole degradation of the illness, and it really needs to be addressed and given serious forefrontal thought, or whatever that means.
Yeah, so it's just really about developing a plan, a course of action, like how, you know where you want to be, what you want to do, but how do you get there? And as a coach, I just help you navigate that. Yolanda, I have multiple autoimmune diseases. The hardest part for me is getting my husband on board. He's better than he used to be, but I have to do everything such as food, prep, supplements, etc. I almost have to force it versus doing it together.
Yeah, and that's unfortunately so difficult because, you know, I mean, you look healthy, right? And so why could there possibly be anything wrong with you? So you must not need any help. And it's, it just is so true. It's so hard. People get compassion fatigue. And doesn't matter if it's a man or a woman, I will tell you that they will tell you that their spouse almost always is suffering from compassion fatigue. That's not the way they view it. That's my kind way of saying it. But it is a big, real problem, because if the person who knows you the best, as you said, I feel like maybe I'm just lazy. Well, if your husband thinks you're just lazy, or your wife thinks you're just lazy, nothing's going to go well from there. And unfortunately, chronic disease is second only to financial problems that lead to the decay of relationships.
Yeah, where, once I finally accepted the fact that I couldn't do those things and really listened to my body and started to navigate from that point, not the point where I thought I should be, but the point where I was at, and take those little steps, did I really start to see a change. Because otherwise I was just always fighting with where I should be.
Yeah. People who have chronic illness, they sort of put life on hold sometimes, thinking, well, when I get better. But the truth is, life is right now. And you should have the most beautiful, robust life you can possibly have all the time. And what you just said is exactly that. I'm going to accept what I can do.
It was my greatest teacher for being present in the moment, because really, not until I became present in the moment did I really start to even come close to just surviving.
Right.
It was, just about bringing myself back to the present moment.
And we don't want to survive.
No.
We want to thrive.
Right.
Right? So, yeah, how do you get to that thriving, even if...
You can thrive even in the midst of chronic illness.
Yeah. And I know that if you're feeling really crappy at home right now, and somebody is saying it really is possible to thrive, you got to be thinking, what a complete moron. They don't have any idea what they're talking about. Well, unfortunately, the life you have right now is the life you have. Whether you feel fantastic or whether you feel terrible. And the way you feel is it's a state. It's a truth. But there's another truth, an equally important truth, and that is that life is precious and beautiful, and there are still, kids and relationships and grandkids and, you name the relationships out there that are important and that you can build and cultivate. And there are meaningful things that you can think about. If all you can do is think about... Van Gogh is said to have done his best painting as he was going blind, and Bach, was it Bach who was going deaf during his last symphony? And there are all these incredible stories about the unbelievable human spirit and what people, Helen Keller or Anne Frank, it is possible. It's not easy. It's not easy. And I'm not trying to trivialize this. This is difficult. But finding purpose and creating meaning is one of the most important things that someone with chronic illness will ever do.
Yeah, and, we're given this, I thought of it as like this rare ability to really just, zone in and be present with myself.
My friend.
My chronic illness was my biggest teacher. Because of it, I transformed the way I saw my life, I saw the world around me, and it really ended up being this beautiful thing, even though, when you're in it, obviously, it's a different story, because again, I think you're fighting with where you used to be and how you used to feel, and sometimes when you're having that pain all day long, which John Kabat-Zinn is a great resource for dealing with pain just through being mindful and present in meditation. So
he's got a couple of books. One is Wherever You Go, There You Are. It's a great book. But the one about his chronic pain program, Full Catastrophe Living by John Kabat-Zinn. Great book about using your mind to treat pain. And he actually runs a pain management program at one of the Harvard affiliate hospitals. And his statistics for getting people better are actually better than the statistics generally seen in interventional pain clinics where they give drugs and injections and burn nerves and all of that stuff. So it's not trivial. It's real. It's powerful.
Yeah, and think of that type of meditation, if it can help you deal with chronic pain, where can you apply this to so many other areas in your life?
Yeah.
Fran said, and you had the best doctor ever.
There you go. Who was that?
For me?
Yeah.
I didn't actually, I pretty much navigated the chronic illness alone for the first 8 or 10 years and managed it on my own, doing all of those things. And then I did meet, I had met you long before that, but I started working with you, and then we really started digging in deep. So yeah, I would say he definitely got me to a higher point than I could have without him. And actually, if I would have gone to him 8 years earlier, he would have saved me 8 years of trial and error and trying to figure it out myself. So
I've pushed the message from Amy 6 times and it won't expand for me.
I have magic fingers.
What is this?
Magic fingers. Okay. Amy, I also have multiple autoimmune diseases I'm dealing with. I've been in low places throughout the past 15 years.
I'm sorry.
Since my life was flipped upside down.
Yeah.
I've slowly tried to pull myself out of that hole, and I've tried to live in the moment. The hardest part I feel is truly feeling my own worth and not giving into the thought that these diseases will take me out of this precious world quickly. You both are great. Oh, thank you.
Thank you. I'm a crybaby. It's making me cry. It's heart-wrenching to hear the stories. And I was talking to a physician on the phone today. My eyes are watering. I don't know why my eyes are watering. Yeah, like I said, I'm a crybaby. I cry in clinic every day. I was talking to a physician on the phone today, and he's an allergy specialist, and he does this thing called sublingual immunotherapy, and I use his program. But now my eyes are burning like crazy. And anyway, he was saying it's such a travesty because this stuff works so good. You know, like 80% of people with allergies, their allergies go away, and 60% of asthmatics don't have to use their inhaled steroids anymore. And it's just a tragedy. And it really is. You know, there are so many things out there, and functional medicine is one very powerful system that really, really helps people.
Yeah. Let's see. Oh, and Christina is watching. Hi, Christina.
Hi. Holy mackerel, we've been on a long time already. Time flies when you're having... Oh, my battery low light just came on here. I'll turn that off. So, if there are other questions, we're happy to entertain them. My battery's low and we're running out of juice, so we may sign off and be back next week. So we left you with the challenge of telling us what you wanted to hear about next week. We talked about Lyme this week. I don't know. Seems like there's a lot of autoimmunity out there on this in this group. Maybe we should talk about autoimmunity. What do you think about that? Talk about autoimmune disease and what it does and how we deal with it. Christina, hi, and Misty.
Please share your website link. We'll do that.
Oh, okay, we'll do that.
I'll make sure.
It is justbewell.info, but we'll put it in the comments. All right, so next week we're talking about autoimmune disease and the functional medicine approach to autoimmune. And You guys have a wonderful weekend and a good night.
Unless you have any other questions before we go. Don't want to leave anybody hanging.
No.
Nope.
All right.
No.
Oh, I just whacked my microphone too. I'm sure everybody loved that.
Please
All right.
and thank you.
Yep. Good night.
Bye.